Welcome back to another Keenmatic video, guys. So today in this video we are going to be talking about breaking bad news, which is a feature of the communication skills station. In this video we're going to be talking about the scenario. We'll then talk about your approach to the scenario, okay, your approach to the specific scenario as well as the breaking bad news. We'll then talk about the overall approach that I would advise personally, okay? And then we'll talk about the main principles that kind of govern breaking bad news. It doesn't matter what the actual station is in terms of the content of the station. There are certain principles that apply to every single breaking bad news station, and to a large extent the communication stations as well, okay? Every time you see this bell icon, make sure you pause the video, have a think, so that you gain the most out of this video, guys, okay? For those of you who are really motivated, want to progress your careers and pass PACES, this course is for you guys, okay? So PACES course online, I've brought together my years of experience in teaching doctors and also students to bring together lots of different frameworks and useful material, including top presentations that come up in PACES that I have written myself, lots of frameworks that you can use from day one all the way up to PACES, as well as plenty of downloadable material that I have put together just for you. Okay, this is exclusive to the course. Lots of people are finding value. Make sure you go check it out. The description is down below. And because you have subscribed to my YouTube, you're watching my videos on YouTube, I've also created a code just for you guys. So you make sure you use the code when you are getting the course for yourself. Okay, go check it out. Let's carry on. So here's the scenario. You are the medical registrar in the general medical clinic, and your next patient is Emma Childs. She is a 32-year-old lady who was referred by her GP a few weeks ago due to paresthesia and numbness in both her hands and feet over the last few months. Okay, so hands and the feet, paresthesia, numbness. Young lady. Okay, you should be thinking about what's going on. I'm sure some diagnoses are coming into your mind already. But remember, this is not just about the diagnosis, it's also about the communication. So, your task is to inform the patient of the diagnosis and the further management plan. Okay, she's had some tests done. So, here are the tests. She attended the ambulatory clinic last week for investigations for her symptoms, okay? And these tests are as below. Her blood test completely fine, no abnormalities of note. All right, so electrolytes, full blood count, everything else is fine. Okay. The MRI head shows periventricular plaques. Okay, which is quite typical. The lumbar puncture done last week shows oligoclonal bands, which are present in the CSF but not in the serum. Okay, again, this is classical of a condition. It should come from your kind of clinical background, from your MRCP part 2. Okay, so have a think. You basically have a young lady, and you have got paresthesia and numbness in her hands and feet. She has had MRI, which is periventricular plaques and oligoclonal bands in the lumbar puncture CSF. All right. So, what is your diagnosis, and what would be the further management? So, this is very much a clinical question at the moment. What is your diagnosis? What's the further management? Have a think. In the meantime, do press the like button below because it really helps with the video and the YouTube algorithm. It helps educate other people and grow the channel as well, guys. So do press the like button. Thank you. Have a think. Once you've done that, let's move on. So the diagnosis is multiple sclerosis. Okay, nice and straightforward. Multiple sclerosis. This is it. But the station is not about you reaching a diagnosis. It's about how you are going to tell the patient the diagnosis. Okay, and also issues around it. Okay, that's the whole point of the station. How are you going to break the bad news? Now you need to think about this, okay? Try and come up with a framework in your mind as to how you are going to break this news to this young lady who has no idea about any of this. Okay, So I hope you've had a think. So here's the overall approach that I would recommend. Okay. First and foremost, as you go into the station, establish the identity of the person in front of you first, okay? You will have the patient's name and potentially the date of birth or their age at least. So you should always check that you've got the right person with you at that moment in time, okay? Of course, in your PACES exam, there won't be an issue with that, but still, it is something that the examiners will keep an eye out because in real life you can easily get patients wrong. Okay, so check the identity first. It's a very basic thing. Don't get that wrong. And then, so check and confirm the history. So I would say something along the lines of, I understand you've had some pins and needles and numbness in your hands and feet, which brought you to our medical attention. Is that correct? And then she will say yes. Okay, and then you can confirm a few more things, whether she's had weakness, for instance, whether she's had other symptoms, any visual disturbances, any blurring of vision, stuff like that. You can confirm all of this. Okay, just because it's a communication station doesn't mean you can't confirm symptoms. That's okay. It's just that you shouldn't be focusing on it. That's the whole idea. Okay, don't treat this as a history taking station. This is not what this is about. Okay, once you've done that, get some social history because it is important in terms of work, family life. Okay, that's important. And whatever the diagnosis is in your communication stations, most likely it will have implications on their work and their family life, their disability. So you need to get some idea of their lives, basically, and the general implications. Okay, so that's why it's important. After that, check for any ideas, any concerns they might have. Is there something on their mind already that they are concerned about, whether they want to check something in particular before you continue to give the news? Because sometimes they may well have an idea of what might be going on. They may be worried about something completely different. They may be worried about cancer, for instance. Okay, but the key thing is that you should be checking, okay, before you give the news, just so you have an idea of where they stand. All right, okay. And then offer if they would like a nurse or somebody else from their family or their friend, next of kin, somebody to be present while you're going to be giving the bad news. Okay, basically, don't tell them that you're going to give them the bad news and that they whether ask them if they want someone. Just say something along the lines of, before I give you the test results and what they mean, would you like anybody present with you, perhaps a nurse from our team or a family member or a friend? That's it. Nice and simple, okay? That's it. If they say no, they're happy for you to continue, which they will be in the context of PACES in your exam. You just continue, okay? And you basically give them a warning shot. The warning shot is to say that it is not a good news. Okay, so something along the lines of, I'm afraid it is not good news, and then just give it a moment for that message to sink in. Okay, rather than just rushing in. Once you've told them that, don't just wait for them to erupt, so to speak, or crash into a pool of tears. Give them the news. Okay, the whole idea is you need to give them the news and then proceed. So give them the news, keep it simple, keep it free of jargon. Okay, keep it free of jargon. That is important. And after you've given them the news, be silent and just wait. That's it. They are most likely going to be in shock and very upset. They may be very much having a overwhelming feeling of fear potentially. They may well be in absolute denial. Okay, there are a lot of different emotions that can come to people, come to us as individuals, as human beings, when we are given big life-changing news, which a lot of the times in these stations they are. Okay, or they may be completely clueless. That is also possible. They may have no idea at all what you have just told them. Basically, that is also possible. Okay, but the idea is that you need to just give them the time, let them be for a moment. Okay, Not for a whole 1, 2, 3 minutes. No, just give them a good number of few seconds. I would give about 15, 20 seconds, let them be. If they start crying, for instance, offer to get some tissue. There may or may not be any tissue in the room or by the table. Sometimes there is, you would be surprised, in which case offer them the tissue. If not, then you just say that, would you like some tissue, can I get you some tissue, or a drink or some water, okay, some anything. That just shows you're a compassionate human being, and that goes down very well with your patients, okay, and the examiners like that as well. And you should be that anyway. So it's not just about the exam, it's just about showing compassion, okay. And after you've given the news, after you've let them be for a moment or two, offer to answer any questions that they might have. Okay, simply just ask them: is there anything that you would like to ask me at this moment before I explain what this means and how we are going to proceed with this? Okay, something along those lines will do. And then ICE. Okay, so ICE is your mantra when it comes to communication stations. Okay, so ideas, concerns, and expectations is what you need to be living by for every single communication station. Okay, so ideas. What do they think? Is there anything on their mind? That's ideas. Okay, concerns. Is there anything worrying them? What are their thoughts about the condition? That's concerns. Okay, expectations. What did they think would happen today, or what do they think the condition is about? What do they expect will happen in the future with themselves, their conditions? That's what expectation is. Okay, so ideas, concerns, expectations, always check these things. These are the three things you have to check all the time. Okay, so, moving on, after that, what I do is check their understanding of the condition itself and the management. Okay, uh, some of them, let's say you've got a nurse, okay, or someone from the medical professional team, they may well know a lot about it, which makes your job a lot easier. If they don't know a lot about it, then they will tell you. Then you can explain. But if they do, then it saves a lot of precious moments for you, okay? Precious time. So you can just carry on. But let's say they don't. Then you need to be quite clear and free of jargon, okay? When you are explaining conditions. So you need to think about different ways of explaining different conditions before you go into the exam, just so you have some idea of what you would say for certain conditions, just in a simple manner, for someone who's not medical. Okay, for something like multiple sclerosis, for instance, I would say something along the lines of, it is damage to the nerves, and like how wires are, and they have got insulation around wires, it is damage of the nerves, insulation around them, and that can cause symptoms like the ones you have had, which is numbness and pins and needles. And then you would have to explain things about how it can progress, for instance, that there are different types that you can't really know, for instance, that which type it is until some time down the line, that sort of thing. Management, again, you would need to explain that it is largely based on steroid immunosuppression, and managing muscle spasticity, physiotherapy, things like that. Okay, you need to explain these things. All right, so that's what I've just mentioned. Explain the condition in symptom terms and break the management down into clear, digestible elements. So when it comes to management, okay, so every condition, of course, will have different types of management, but you can have different categories for you to help remember in the heat of the exam, in the pressure of the exam. I would suggest 4 different categories for you to remember. Okay, these categories are symptom control. So, regardless of what the condition is, you are going to need to have symptom control in mind. Okay, whether that's cancer, diabetes, multiple sclerosis, surgical issues, anything and everything, you need to always treat the patient's symptoms, because that's what they can feel, isn't it? So you need to treat the patient's symptoms, okay? Symptom control. Secondly, the medical management of the underlying condition, okay? So the medical management. And then surgical management. Not all conditions will have surgical management as an option. Multiple sclerosis, for instance, will not have surgical management as a condition to treat the underlying condition. You can't do surgery to treat multiple sclerosis, right? And lastly, palliative management. So palliative meaning in the sense that, so palliative is for symptom control, but also if someone is reaching their end of life, so advanced conditions reaching their end of life. So the palliative team would need to be involved in their care and their management. Okay, so these are the four categories that I would suggest you remember. So in terms of management, those are the four categories. In terms of specialty, I would always say that you should always be thinking about an MDT approach, multidisciplinary team. Okay, so any condition, if it is featured in your communication station, in your or in PACES, most likely it will have to have multidisciplinary team approach. Okay, not all conditions, of course, but most conditions will need that. So always have that at the tip of your tongue, and always be mindful of what you're going to say in terms of who you're going to involve. Okay, and a lot of these conditions will probably need some kind of community support with their GP, and a lot of the times, there are specialist nurses that can get involved as well. So in this specific case with multiple sclerosis, you would have the neurology team, the physiotherapy team, and the occupational therapy team. There would also be specialist nurses involved, okay, and of course the GP and the community. I hope that makes sense, guys. And towards the end, what you would need to do is reassure them about the follow-up, okay, and the monitoring. Of course, this is going to be a long-term condition, and their follow-up is going to be crucial in managing the condition and maintaining continuity of care. Okay, offer to explain the condition again later on down the line, because obviously this is a big news, and they may not have um, they may not have the right frame of mind to process everything and digest everything in one go. So offer to explain again in the next appointment, okay? Or even ring them or something like that. It's all about treating the person in front of you in paces. It's not real life in that way, because you may not be able to accommodate everything like that in real life, but you have the luxury of being able to offer these things in paces. Okay, so make the most of that, in the sense that offer to explain things again, offer to ring them, things like that. Okay, involve the nurse specialist. So most conditions, as I mentioned, will have some kind of nurse specialist. Multiple sclerosis will have that too. So involve them, and tell them that they can always ring the nurse specialist for advice if they're not clear about something as well. Okay, and arrange follow-up and give them a leaflet. So leaflet will be the written information about multiple sclerosis, the management, all of that. Okay, so always make sure that you say something along the lines of, we have covered a lot today. I understand this may be a lot to take in one go. We can always talk about this again down the line. I will give you some written information in the form of a leaflet to take home so that you can have a read. You can also go online to the NHS website to have a better idea of what the condition is. Do you have any questions? And then you can just nicely tidy things up like that. I hope that makes sense, guys. So let's go back to the main principles of breaking bad news. Okay, so we'll just run through them. First and foremost, every patient is different, okay, and they will have different concerns, different understanding, expectations, emotions. Don't assume anything as you are going into the station, okay? Ask if you're not sure. They may well know a lot about the condition. They may well know nothing. They may well know what to expect. They may not know anything. You can't make any assumptions. You need to check with them, okay? And then take it from there. A lot of candidates make assumptions, and that is it's a deadly downfall in communication stations. You need to just keep an open mind, not make any assumptions. Okay, just ask the patient. Don't use any jargon. They may not be medical. Most of the times they will not be medical. Don't use any jargon. Using jargon will not go down well. Okay, keep things simple. Explain things simply. Okay, as to explain things like you would be explaining to your mum who is not medical. Okay, imagine that. Imagine someone who is not medical in your circle, and imagine you're explaining to them, basically. Key pacing, ideas, concerns, expectations. Okay, that should always be at the top of your mind. Always check if they've got concerns and answer any questions immediately if you can. Be compassionate. So your compassion will go a long way. Phrases such as, I can see it is very upsetting for you. We are here to help you through this. That will go a long way in showing that you care, okay? And that is what matters to your patients. That you care, okay, and that you are going to be there for them, and that you're going to help them through this, which is what this is all about, okay? Invite questions, let them talk, and answer the questions, and arrange follow up and provide written information at the end. Okay, I hope that makes sense, guys. I hope that's useful. Make sure you check out the PACES course linked below in the description with the code. Use the code when you are getting it, and also the book. Both of them have links below. I will see you in the next video.